First, I want to thank Dr. Stefano, for really leading this pillar. My role has just recently been as chair of the communications pillar, and want to give a big shout out to Allison Powers, who kind of helps from an administrative side for everyone within the YFA. And Ash and Claudia, I haven't worked with them much, but they are clearly integral parts of this work group. And one of the points of these discussions today will be so that everyone can find and learn more about the work groups. And at the end, if it's something you're interested in, we'd be excited to have you as a member. So the current work group responsibilities, really there's kind of two main ones, and they reflect around social media. So the management of our Twitter account, and then the YFA newsletter. And again, if someone is interested in helping with the Twitter account, just please let us know. It's an easy way, again, to get involved, and it really keeps people connected and keeps you up to date on extremely relevant and powerful topics. The YFA newsletter, it's kind of an open-ended essay. Topics range from essentially anything from, would an advanced degree help, to what is it like to be in a fellowship? Is a fellowship worthwhile from a fiscal perspective? So really the essay topics can be what you'd like of them, and it's kind of an easy way to get a line on your CV as well. So one of the things we did this year, the governing council is the group of members who are speaking tonight, but then there's a lot of liaison positions. And the first way I got involved with the YFA was through a liaison position with the Board of Governors Survey Work Group. And this was, again, through the communications pillar. I've been in this role for about 4 years now. And what we do through the college and through the governors is there's probably a group of any year between 8 and 15 governors who sit down and draft a survey. The topics in the survey are supposed to be relevant and up to date, and then they get pushed out to all the governors. Now, again, they've been doing this for quite some time. The data then gets reported back to the governors. Well, Allison came up with a great idea, is why don't we take that exact survey, change some of the verbiage in it, and give it out to the leadership within the YFA. Again, that's everyone on the GC and all the liaison positions. This is the first year we ever did it, and the topics that were covered, again, these topics were vetted by the governor. So demographic information, surgeons retaining control in the surgical environment, the peer review process, evolving surgical practice trends, and the needs around the COVID pandemic. Allison, can we do the next slide? And so what we did was we sent the survey out. We had, I would say, a really good response rate. I believe it was 40 responses out of 56 individuals, so 71% response rate. Anyone who's done survey data knows that that's phenomenal. However, it's interesting, when the governors respond to this, their response rate's usually 94, 96. We've even had years when there's 100% rate, because it's part of the job description of one of the governor's responsibilities. And it's something we might suggest later on, is if you go into the leadership circle, liaison, GC, that this survey, if it continues and the governors say we can continue to use it, it may be a wise thing for us to ask that if you do step into a leadership role with YFA, you do fill out the survey. So we found out from our just 1 year data that there is an increasing need for female leadership within the YFA liaison position. But if you look at the GC, the male to female ratio was pretty good. I think if you kind of look at the tiles on the board here, you can see there's a very nice female representation. We need to improve surgeon leadership opportunities within the hospital system. That was both seen at the governor level and within the YFA group. So if you look, the college has multiple ways to improve your leadership skills. There's even a course on leadership. This is something that was different. The governors felt that the peer review process at most hospitals was not fair and biased. However, the YFA felt that the peer review process was fair. So people under the age of 45 much more believed in their peer review hospital at their home institute. Majority of individuals within the YFA felt that it was important to maintain private practice, that it needs to continue. However, 95% of people who filled out the survey felt that it was not a continuable model in our current setting. 75% of surgeons 75% of the YFA members who filled out this survey felt that there was good inclusion within the college. 25% though didn't. So that's again an opportunity for improvement, and it was highlighted by the governors in their discussion. One area that was drastically different from the governor's response was in regard to telemedicine and COVID. The YFA respondees, 88% used telemedicine, 60% it was for the first time, 90% wrote an improved care. So in compared to the governor's response, much lower for use of telemedicine, much higher for first time use, and much lower for improvement of care. Next slide. So maybe some expectations. Amelie and I were talking about this, and clearly none of this is set in stone, but it'd be great if everyone on the Governor's Council almost had a Twitter account, and I think we all do. It's just more so using it and promotion and making sure we all are aware of the YFA ACS tag, and then retweeting, if you will. And then for the GC, it'd be great if everyone drafted one essay for the newsletter. Again, just suggestions that would, I think, help give a voice to all the members. Next slide. And then expectations for the YFA leadership. Again, this has to do with newsletters, just finding something to post on. And then leadership, back to that survey. If we could get the survey filled out by all of our YFA leadership members, it'd be fantastic. And then next slide. And that's it. So it's really a group highly committed to communication. And one of our goals for this year will be to try and link up more so in a linear fashion between the college, the YFA, and RAS, as each one of those has their own communications pillar, and to work in a model disseminating information and not trying to replicate things over and over, but using the examples we have from the college and RAS for that matter. Thank you.
So Chris, I'm going to jump in here out of order and ask a question. So certainly you're interested in newsletter submissions outside of the Governing Council as well. What sort of newsletter submissions from the broader Young Fellows Association membership are you interested in having?
Allison, can you go back 2 slides? So here's some areas that I thought would just be really nice. If you look, there's, so if you go to one more forward, I'm sorry, one more forward. The other way. Keep going. One more. There we go. So if you look at the newsletter post, so if you go to the Leadership Advocacy Summit, write a newsletter on it. If you're selected to do the leadership course through the college, write a newsletter on it. If you go to the ACS Educators course, write a newsletter on it. If you are into wilderness medicine, write like anything that's a unique example. I think I saw in the thread a question for Dr. Marth about, there's no local chapter in Pakistan, right? If you have a local chapter, if you're an international governor or representative of another chapter, write a newsletter on how that chapter is founded. So the topics need to be, I would suggest, surgical in nature, but they don't need to be on current treatment models for XY disease. So they're much more broad-based, and what our goal should be, what we see and what we get are phenomenal. People spend a lot of time and energy writing them. What our goal should be is how do we promote them so more people actually get exposure to read them. And that's where I think we as the GC can do a better job in stepping that up a little bit.